Hi, good morning, everyone. Dr. Kaylee Simmerman here with the Hope Doctors, pelvic floor physical therapist. Super excited to chat about today's topic because it's something that keeps coming up, not just in the clinic, but online, because there's just so much information out there about this topic. So the question in and of itself is, will exercise make pelvic organ prolapse worse? And I want to separate that into two questions because there's one side of it where will exercise make the actual pelvic organ prolapse worse, or will exercise make the pelvic organ prolapse symptoms worse? Those are two separate questions. You'll hear my son in the background. First and foremost, let's talk a little bit about what prolapse is. One thing that I like to remind people is, yes, prolapse is the descending of the organs. So like the bladder, the uterus, the rectum, other things when we get into that. But when things start to come down to the vaginal opening or the rectum or the rectal opening, but they start to descend. But the false perception is that you actually have like damage or tearing of your organ, and that is incorrect. What's actually happening is it's fascia. So I always like to think of, you have like a ball, right? Let's pretend this is your bladder. And then let's pretend that these are the ligaments or the structures, the fascia, holding the bladder where it needs to go. What happens is the fascia itself starts to stretch and get lengthened, sometimes can tear, which allows that ball to kind of fall down. It is not the bladder itself that has had damage to it that's making it drop. It's the fascia or the structures that are holding it up that's allowing it to descend. And I say that because your organs are not damaged if you have pelvic organ prolapse. The fascia is. And so the fascia around it. And that's also why it's a really hard concept when we're thinking about pelvic organ prolapse to think about the fact that you can't take it away and you can't always lift it all the way back up, right, without surgery. Because the ligaments or the fascia, once those are torn, they're not muscular, so they're not going to be able to recontract. Yes, there are things that we're seeing in research that can help, collagen and different types of diets and red light therapy and those kinds of things can improve the structure. But I'm very cautious about ever saying that it's actually going to go away or lift it. So, and I say that because I don't want false hope or false belief. So give yourself a little bit of grace with that. So that's kind of what pelvic organ prolapse actually is. And so let's talk about first with the structures being descended. If you go and you exercise, then are you going to actually make that descend more? And I always like to say there's so many clarifying questions around that, so I can't answer that with just a simple yes or no. The answer to that actually is it depends, because let's say that you have been active your entire life and you gave birth, and that's what kind of contributed to the pelvic organ prolapse. We had a vaginal delivery, we had some fascial tearing, we now have, let's call it a stage 2 cystocele, or the bladder has dropped down to what we consider a stage 2 to right at the opening. If you are doing the same amount of exercise that you've done beforehand, you're not having symptoms, and you have seen a pelvic floor therapist and done all the things, very, very low. And I mean, I would almost say that there isn't a likelihood that it's going to get worse. When I say, or when I'm cautious about an exercise when you have pelvic organ prolapse, is when I get a client that comes in and they say, I've never been active, or I was really sedentary, now I have prolapse, and now I'm going to go to do CrossFit, or now I'm going to go to do Olympic weightlifting, and now I'm going to go to train for a marathon. Those are things that your body has not had time to prepare for, and we haven't been able to prepare your body, your pelvic floor, the muscles, the diaphragm, like all the things to be able to support and manage the pressure to keep the pelvic organs to where they want to be. So again, can exercise increase the descending of the organ? It can, if you're not paying attention to pressure management. So again, what that means is, how does the abdomen work? How do the glutes work? How do the adductors work? How do the muscles surrounding the actual pelvic floor work together to keep the organs up and in, or to keep them maintained, right? There's so many layers to this that it's way more complex than just a simple yes or no. I always tell clients though, like, one, if you're suspecting that you have prolapse, or if you know you have prolapse and you want to exercise, we want you to exercise. Go to see a pelvic therapist, because the cool thing is, we've seen over and over and over, and I've preached this for many years, is strength training with proper pressure management, or understanding how to utilize your pelvic floor well with strength training, so meaning lifting weights, is the best thing to do for pelvic organ prolapse. That's going to set us up for success to prevent issues later on, to decrease symptoms, to prevent symptoms from worsening. So it's an absolute yes, we need to be exercising with prolapse. There's so much information online that's like, don't do this, this is unsafe. I never say anything's unsafe or to don't do something. It's more so, how are you doing it? Because it's never what you're doing, it's how you're doing it, right? So if you want to lift heavy, great, but how are we doing that to protect the pelvic floor? It's also where we get into the symptoms of it. So the second piece of this question is, when I start to exercise again, when I have pelvic organ prolapse, will the symptoms increase? And again, it depends. Some people yes, some people no. So it really is just dependent on where the prolapse is, what type of prolapse, what are the triggers, and what are the potential factors surrounding the pelvic floor that are maybe adding to the pressure or adding to the lack of stability or control, right? This is where we get into things like we want to learn how to pressure manage. Are we coordinating with our breath well? Are we coordinating with our core well? What are we doing right before the workout? So for example, for me, I have a stage 2 prolapse. I will do a lot of things to just engage my core and my glutes right before I do a heavy lift. Because if I don't set myself up there, my pelvic floor takes all the pressure. It's just what I do. It's just how my body patterns are. And so seeing pelvic floor therapists throughout my history, also seeing myself, knowing what I do now that I'm an expert in prolapse, like I've really been working on that. And so setting up a warm-up routine that works for you, doing the workout and understanding how to breathe with the lifts, understanding how to actually scale the lifts, and then doing a proper cool down to decrease those symptoms can be really important. I never guarantee that you're going to be symptom free. Like that's the thing with pelvic organ prolapse, is we will often always struggle with some form of a trigger, meaning there might be a heavy lift. Like for me, for example, when I go past 100 pounds on anything, I tend to have trouble with my pelvic floor symptoms. If you are hiking, for example, and you get past like mile 5, that might be your trigger. Constipation is some trigger. And so just giving yourself grace as you go through this journey to learn which exercises are best for you, what type of workout is best for you, knowing how to implement the strength training is really important. And then also we can tie into other things like pessaries, right? Like pessaries are an excellent tool to be able to utilize when you're lifting, when you're hiking, when you're holding your child, the things that usually would contribute to symptoms. However, it really helps to support the organs to prevent. So like the pessary, you insert it and then it helps you kind of lift it back up to prevent it from going down or giving you the symptoms that you typically experience. Because we do want to prevent surgery if we can, right? Like we do want to see what we can do holistically, conservatively before we go through a surgical procedure. We do want to make sure that we're paying attention to the pressure management, adding in the exercise, doing all the strength training that we can, seeing the pelvic floor therapist, and doing all of that, because that's what's going to really benefit us long term. So hopefully that clarifies those two questions on, will exercise make pelvic organ prolapse worse? Best case scenario is see a pelvic floor therapist. I do a lot of virtual work with clients around the world that have pelvic organ prolapse, and strength training and learning how to and what to and doing all the things. So make sure that you follow me on Instagram at Dr._Kaylee, and check out our website if you're looking for any virtual services or anything like that. But it is not the end of the world. You are not broken. You are going to be okay. We can work with this, and give yourself lots of grace and lots of positive feedback.